Good evening, good evening. This is Marie Holiday, and I hope everybody had a fabulous day today. Before we get started with today's lecture, hit that subscribe button and notification button so you can be notified of ongoing uploads. And please subscribe to this channel and share this channel with one person in your household and get them to subscribe. You know, this channel is nothing without the support of its subscribers and viewers and potential subscribers. And I really do want to thank everybody for blocking out time out of their busy life to follow my channel, to watch my videos, to send your comments. I really do appreciate that. So with that being said, let's get down to today's lecture. I want to talk about addiction, substance use and recovery during the COVID-19 pandemic. And I'm going to just present some very informative information in reference to this topic. And I just want to remind the audience that I am a licensed clinical addiction specialist. I've been credentialed with my license for over 21 years. And I'm qualified to assess and treat people who are suffering from alcoholism, drug addiction, and gambling addiction. So I really do like presenting these specific topics. Is what I do. So with that being said, let's get down to business. So again, the focus is addiction, substance use, and recovery during the COVID-19 pandemic. And I want to say first of all that the COVID-19 related social isolation and stress can increase anybody's susceptibility to substance misuse, addiction, and relapse. I'm here to tell you. You know, it is a direct correlation. You know, with the COVID-19 that's been going on since 2020, with job loss and people not being able to pay the bills and take care of their kids and losing everything they have, that can have a toll on anybody in terms of stress. Substance use can lead to immune system, respiratory, and it may increase susceptibility to the COVID-19 as well as complications. And when a person is abusing various alcohol and drugs at high amount. A number of remote resources are available to help assist individuals and loved ones. There's a lot of 1-800 numbers out there that a person can call about getting help for their alcoholism and drug addiction or stress. Local health department, or you can continue with your current treatment, support a family members, loved ones, and your sponsor if the need arises. During these uncertain times, those who misuse or abuse alcohol or other drugs are particularly vulnerable, and I'm here to tell you. The stress from social isolation and other COVID-19 related life changes can lead to or worsen substance use and misuse. You know, that stress can have a toll on anybody. You know, in terms of the COVID-19 related issues can have a toll on all of us. But for people who are already suffering from alcoholism and drug addiction or in recovery, they are more vulnerable to all these COVID-19 related problems, and I'm here to tell you. So with that being said, I'm going to talk about specifically in this lecture I'm going to present 3 health risks. There are also other health risks resulting from chronic alcohol and drug related use, as it weakens the immune system and puts stress on the body's cardiovascular and respiratory system. So in presenting these 3 health risks, number 1, I want to focus on alcohol. Alcohol consumption, believe it or not, weakens the immune system and can increase the susceptibility to certain infectious diseases. And I'm here to tell you, you know, there's a lot of alcohol and drug related health problems. When you're talking about alcohol related health problems, you know, it weakens the immune system. It really does. It can be a person can develop alcohol-related heart problems, alcohol-related diabetes, cirrhosis of the liver. But excessive alcohol use does weaken the immune system, and it can increase a person's susceptibility to infectious diseases. For individuals who are dependent on alcohol, restricted alcohol can lead to symptoms of withdrawal. Alcohol withdrawal can be fatal if not managed properly. That's one of the reasons why the person has to seek medical detox to get the care of the medical professionals when they're experience withdrawal from alcohol. I want to talk about cocaine, number 2. Smoking or snorting cocaine causes changes in the brain that results in constriction within the vascular system, the arteries, the veins, the capillaries, etc. And snorting cocaine or smoking cocaine can lead to severe damage of the lung and the respiratory system. Smoking cocaine can lead to many other complications to the lungs, such as swelling, hemorrhage, bronchitis, asthma, and emphysema. So there's many health-related problems that can be caused by the use of cocaine. I mean, it's more than this, but I'm just presenting the most ones that are up front foremost. And it just gets out of hand with the medical problems that are a result of the excessive alcohol or drug use. Opiates, number 3. When opiates are taken at a high dose, they act on the brainstem to slow breathing, which leads to a decreased oxygen in the blood. This put opiate users at risk of overdose, and this is why opiates are particularly dangerous and often fatal. So if a person's abusing opiates, they really need to get in treatment, detox, rehab, etc. So I'm going to talk about some very important resources, treatment type resources, because the disease of addiction thrives on secrecy and loves to catch people off guard. I'm here to tell you. It basically can progress very quickly, especially during the COVID-19 social isolation. That's one of the pitfalls of this COVID-19, the social isolation and the correlation of the progression of the disease of alcoholism or drug addiction. So, if you are dealing with strong cravings or relapse, please contact your local provider immediately, local health department, sponsor, 1-800 numbers, support of friends and families in a rehab. There's so many resources out there for someone who may need help with alcoholism or drug addiction or mental health related problems. Many providers, because of the COVID-19, are often offering virtual visits via web chat or phone. So you can utilize that as another way to get some assistance with your substance abuse problems, or mental health related problems. So again, there's a lot of ways a person can get help out there. They can call their sponsor, they can NA groups, AA groups, connect with your local provider, local health department, 1-800 numbers, support of friends and family members out there. It's a lot of help out there, especially during this time, if a person just got to pick up the phone and make that call. So with that being said, that's all I have in regards to this topic. Please do not forget to hit that subscribe button and hit that notification button. Subscribe to this channel, support this channel. And with that being said, simplify, simple fidelis, and I'm going to leave this audience in the care of your own conscience. Have a great evening.